Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we love having entrepreneurs come on, sharing their stories and giving us updates. And in this case, we're honored to have with us SweetBio. Here with us, we have Kayla Rodriguez Graff, CEO and co-founder, and Dr. Isaac Rodriguez, Chief Science Officer and co-founder. How are you two doing?
We're doing great. Thanks so much for having us, Jeremy.
That's good to see you again, Jeremy. Thanks for the opportunity.
Absolutely. So we love SweetBio. You two are amazing change makers individually with how much you pour into the community and give back, and obviously as a business as well. And so let's start. Give us a little bit of background for SweetBio. So Kayla, go ahead and dive in and give us some context around SweetBio.
Yeah, well, SweetBio, we are a Memphis-based medical device company that is shifting into a health equity commercial company. We are Latinx and women-led, and we're transforming the wound care industry. You know, it's been decades that the standard of care has been elevated for basic wounds, and so we're bringing higher performance at an affordable price that the industry hasn't seen. And it's been a multi-year journey for us, being med device, going through the regulatory hurdles of FDA and insurance coverage, but we're thrilled to be on the other side and starting to help a lot of patients get better.
Isaac, give us a little bit of the science of this, because Manuka honey plays a very important role in this. And so that's kind of the sweet, and then you have the bio, but give us a little bit of the science.
Yeah, you nailed our secret sauce with the Manuka honey in our product. But we use a collagen and Manuka honey and a filler to create a solid dissolvable sheet. So imagine like a Listerine strip, except for your wound, that would go on the wound and it would dissolve over time. And it could be a surgical wound that's a new wound, or it can be a wound that hasn't closed in weeks to months to even a year. And what our product does is it helps control the microenvironment and maintain a moist wound environment to help either kick that stuck wound out of the stuck cycle and out of the inflammation to get it towards healing, or it can help progress the wound to heal better, faster, stronger than it was before. So that's a little bit of the science behind it. Is, you know, Manuka honey has been used for millennia, and it has been capped in its potential as an ingredient by itself. So we've been able to incorporate it within this solid sheet and be able to deliver the benefits that you see in traditional Manuka honey, except in this patch that can be used on and in the body.
And we'll talk all about the wide ranges in terms of the application of this. And we've had you on different shows in the past, kind of sharing your journey. And I think one, coming out of the pandemic, a lot of shifts and adjustments, and that really opened up a lot of opportunities for you all when you talk about the shift to home. So Kayla, give us a little bit, when you talk about the shift to home with the pandemic, what did that open up for SweetBio?
Yeah, I mean, we all witnessed how a massive industry can change overnight with the pandemic. In healthcare, we saw care going to lower cost places of care when hospitals were full. What became really interesting as us playing in the wound care space is that wound care is traditionally done in a doctor's office or in a hospital. So in the absence of that location, that place of care, what are you left with? And the first realization we had was, if you're not getting treated in a hospital or in a doctor's office, likely the best care that you have is a bandage. Especially if we're talking about tough wounds like skin cancer wounds and diabetic ulcers. This is very difficult. They're difficult to treat. So how might we elevate the standard of care at home? The second realization we had, since you were getting a bandage, was, well, if we brought our product to the home, it's a bit incomplete, if you will. We have that first layer, but imagine just providing the cotton pad of a Band-Aid. You need something to keep it on. So we've partnered with a company to help provide all the supplies you need to be able to get care, elevated care at home. Now, because we're a startup, we had this unique opportunity to sit and listen to the market, understand, you know, is this a temporary shift to home or is it permanent? And very quickly, it became clear that care in home is where care needs to be. not just because of the pandemic, but because those who are suffering from what we're treating are our loved ones 65 and older. They're in communities that have typically been overlooked, that can't make it into these doctor's appointments. And so more so than just the pandemic shining a light on the fact that in-home care needed to happen in a higher proportion, it was the right thing to do for the population that was really experiencing what we were treating. And that drastically changed our focus, and we were able to skate to where the puck was going versus get there after our competitors.
And I like that analogy, skate to where the puck is going, because a big part of this too is you've had a chance over the last really 24 months to really get to know your customers very well. And that has led to a lot of changes and new opportunities, especially in 3 distinct different areas. And so talk about, you hear all the time, businesses need to pay attention to their customers. Well, that's exactly what you've done. So talk about how that's led you to innovate in some new ways.
Yes, what's been interesting is understanding who our customer is and what are their needs in this environment, right? Like, let's call it post-pandemic. What is it that they need? And the first thing is, if you have a customer and you are a business, there needs to be a clear business model. Our physicians are extraordinary. They want to help their patients. Nobody can go bankrupt helping patients. You can no longer help patients, right? So the first thing we did was identify, what is that business model that makes sense for everyone? What is the insurance model that makes sense? Again, we're treating that 65 and older population or the communities that have been overlooked. Medicare is critical. So we went and we got Medicare coverage, which is, it was a 2-year journey for us to be able to get the codings and the coverage that we needed. But that is the critical lifeline for our customers to get reimbursed for the care. The second piece was we needed to provide these kits, and the full kit needed to be reimbursed. And so we've worked with a partner. We've signed our first commercial and reimbursement partnership to compile these kits and have a frictionless billing experience for both the physician and the patient. So great. We've got a business model that makes sense. We've got these convenience kits that make life so much easier for the physician and the patient. We are focusing, and that's the final of the 3, is which area do we focus on? And it's been dermatology. It's only been a couple of months since we've soft launched with our limited inventory, and we've sold out our inventory. We've pre-sold our next runs because of this demand in dermatology. How might we recover better from skin cancer removal wounds? Surgery is great and it's advanced and it's extraordinary how well we're able to remove cancer, but we're sending patients home with, an ointment and bandage, and we are able to do so much more.
Carry that forward, Isaac, on your end. When you talk about the dermatology, the skin cancer, just like Kayla's talking about, why is this so effective? When you look at the science of this, why is this such a powerful opportunity on the healing side and for the patient at home?
For sure. And specifically in dermatology, you're usually getting surgery in places that are visible, that mean a lot to you. So like your face, your nose, your ear, your legs, if you're wearing shorts in the summer. So if you're getting skin cancer removed that's the size of a quarter, it's tough to heal on its own, and you want to take a shower, you want to go on an airplane and feel comfortable traveling without getting an infection. So doing more than just the standard of care to help progress that wound forward means a lot to these patients, just personally as well. When you look on the clinical side, maintaining the wound so that it's basically clean, right? We don't want anything to go bad. And that's what the standard of care is doing now, is let's prevent bad things from happening. Let's cover the wound and prevent the bad. Well, we can do that, and we will do that, but we'll also progress the good, empower the good for the wound there. So those are the 2 reasons why we really see this coming along. This product fitting really well in dermatology is the patients are able to have their advanced wound care at home instead of just standard wound care in the office or just standard wound care at home. And it seems to be resonating with the patients and the doctors very well with the materials that we use. They get excited about honey and learning how Manuka honey helps wounds heal. So that has been something that I, as a scientist, didn't expect. But as we are launching and speaking to our customers and hearing patient stories, they almost increase their compliance because they want this to be successful. They believe in the power of the honey. They believe in the power of a startup. And it's just amazing to see the traction that we've been able to get.
Well, you look at the convenience of the at-home kits. You look at the cost effectiveness partnering, obviously with the collaboration and obviously with the insurance. And then you look at, to your point, people want natural products, especially when you are putting it on your body or in your body. And so I think that's another piece of the equation is the Manuka honey, the natural piece of this, there's an advantage there. And so touch on that aspect of the all natural ingredients, if you will, in terms of what this kind of brings to bear in terms of that opportunity.
Yeah. When we started this company, I mean, we even sound different, but our company name sounds different than a medical device company. We're SweetBio. And my background is at Target, and what we started to see even many years ago when we started the company was there are these trends of customers, soon patients, getting more involved with what they are using, whether that is food and consuming food ingredients that they know and understand, or pets, right? We saw the trend for pet food to go that direction as well. Healthcare has been going that direction for some time. I want to know what's going on my body, what's going in my body. And when we designed the bones of the company, it was, we're going to leverage the materials that we have, which have their own brand affinity, have their own love with honey and building with collagen, and the high science. That's why we're the sweet and the bio, right? But if you look at our social media and you look at our website, you'll see that hopefully you can take a breath when you see it. It should relieve some burden when you land there, because it is about lifting the burden on the patient and lifting the burden on our healthcare system, lifting the burden on our customers. And so with this, let's call it all natural, or materials that or materials that you may love, like honey. We want you to translate that into the good of what we're doing with materials. So it's been a core part of our story to have those materials that people know and love. And it's been extremely beneficial to go mass market, not just niche on natural, but mass market on, hey, these are materials and have been proven. So it has been part of our core, these materials, but it's going to be an even bigger part of our story as we get it out the door and expand into new markets in the next coming years.
How do people watching the interviews kind of say, hey, I want that? So obviously, working with the dermatologist, I know that podiatry is a piece of this as well. So talk about kind of how we can help push the SweetBio story, but also at the same time, how can we take advantage of it?
So really the first step is consulting with your doctor. They probably have not heard about SweetBio, and that's just the reality because we are a startup and we are getting our name out there. But most of the physicians that we're working with today come from patient referrals. So it has been very easy to have a patient go to their physician or speak to their home health nurse and say, I heard about this company, SweetBio. They have these collagen honey patches. Could this be good for my wound? And then if so, have their physician reach out to us. And we're happy to set up a meeting and get the physician onboarded so that you as a patient or as the caregiver of a loved one can get these wound care kits at home. So that's really the process. And it's scalable, but it's also a place to start. So as a patient, or if you're taking care of someone that has a wound, definitely reach out to their physician. We're happy to be resources to facilitate the conversation. But that's what we have seen be successful on that end. And then for reaching out to us, our email is info@sweetbio.com. So your physician can reach out directly to us, or you as a patient can, and say, what kind of resources can you email me that I can then take to my next doctor's meeting? We're happy to do that as well.
What's next? Talk about some of the things on the horizon for SweetBio.
Our first what's next is diving into dermatology. We have a first mover opportunity to be there and be the recovery product of choice. If you're having skin cancer removal, we want you to say, how do I get SweetBio recovery products next? The next What's next is looking at the podiatry market. We have incredible data showing twice as fast wound closure in podiatry, especially those tough wounds like diabetic ulcers. It's the same business model, so it translates really nicely for us, and it helps a lot of folks who are suffering from these tough wounds that aren't healing. The third what's next is we'll continue looking at adjacent markets like recovering from orthopedic surgeries, or women's surgeries like hysterectomy and C-section. But we will be coming out with new products to solve some of the unique issues that those surgical procedures present. And the most exciting is we're on a path. These kits are our first step in creating convenience, right? But ultimately, how might we replace the cotton pad of a Band-Aid? How might we have that peel in place where we have a product on an adhesive that not just covers, but helps close your wound, that dissolves and doesn't add any negative externalities to the environment, and that really can help many more million at home with over the counter. So that's how we'll continue to grow over the next few years.
How has the feedback from the patients that you've been able to help already, how has that helped fuel your desire to do more, grow more, keep pushing, persevere? How has the feedback played a role in kind of infusing that fire on your end?
It's everything. The patients are everything. Having a company, having a startup, being an entrepreneur, there's up days and down days. It's like golf, you miss more shots than you make. And uncertainty is every day. But when you see someone get better because of what you make, and when you see more people get better, that's what drives our decision making. It isn't, of course, we want to build a company that is wildly successful. We are a high growth startup driven for financial returns, but everything we do maximizes our impact. And we make sure that it doesn't compromise the financials of the company, but we drive for impact. And the only way you keep going in a business like this is by remembering what you're trying to do. And we're trying to help millions get better and have at least a more hopeful tomorrow. So the patient feedback it's everything.
Yeah, Kayla and I are brother, sister, Puerto Rican team. So family is at the core of everything that we do. In biomedical engineering, your whole goal is to improve the quality of care for the patients and improve the quality of life. So, we really treat our patients and our customers like their family, and we want them to heal. And when we hear stories that their wound is closed up on a foot on a patient, and now the patient can walk their daughter down the aisle at the wedding, or we saved a patient's foot, and this patient is saying, I'm Hispanic, you're Hispanic, I'm so proud that this is being done in my community. Those are stories that give us chills and that fuel us and that continue just the momentum, because we've been doing this for 8 years now as a startup, which seems like forever in a startup. But really every year is different, and every patient story is fueling. And we know there are many others that we are never going to hear of, but that we strive to have every patient have that experience of getting their life back to where they want it to be, and to be able to resume their normal life. So to say that it fuels us is very big understatement. But it is something that we think about every day, and that we want to make sure that these patients have a great experience, and that we can help generations to come just have lifelong memories because their loved ones are around longer.
Yeah. Well, you've mentioned it throughout. Go ahead and mention it again. Where can we go to learn more and to say, hey, I want SweetBio?
Come learn more at sweetbio.com. We would love to hear from you as we grow, especially expanding in dermatology. So any dermatologists that are listening, or if you're a patient that is having a Mohs or skin cancer or biopsy procedure, please reach out at info@sweetbio.com, and you can follow us on social media, whichever platform you prefer, SweetBio Co.
Well, Kayla, Isaac, thank you for all you and your amazing team do. Thank you for being change makers. Thank you for coming on the show.
Thank you, Jeremy.
Thank you, Jeremy. Love the conversation.